If the back pain treatment you have received isn't working, I'm going to demonstrate a way for you to get up in the morning that will lessen the chance of you causing pain, pressure, or spasm in your lower back as you continue searching for the right type of care from the right type of doctor. This video could end up saving you hours of pain. Hi, I'm Dr. Roy Picard, DC. I've been in practice for 35 years with many hundreds of classroom hours spent in postgraduate studies of functional endocrinology, nutrition, and soft tissue joint stabilization techniques. I, along with the medical doctor and nurse practitioners here at Michigan Integrative Health, specialize in helping those with chronic joint pain of the back, knee, hip, and shoulder. Now, many people, when getting in and out of the bed, don't give it much thought, but when you're suffering with chronic joint pain in the back, whether it's a result of a bulging or herniated disc, foraminal stenosis, canal stenosis, degenerative joint disease, degenerative disc disease, arthritis, failed back surgery syndrome, or bone on bone, you really need to be careful. So whether it's a bed or a couch, or even your doctor's treatment or exam table, when you're lying on your back trying to sit up, if you're like most people, you don't really have a strategy of how to get up properly. It's pretty much more along the lines of I'll do whatever I'm used to doing, and until I get zapped with pain, then I'll go ahead and I'll try to adapt. And the problem is that if you follow that reactive type of an approach, the damage is already done, and depending on what you've got going on with your back, that could end up incapacitating you for a few minutes, an hour or two, or perhaps even a day or even longer. Another mistake that I often see is that some people try to overcome any discomfort by moving quickly, and some people think that the faster they move, the easier it will be. That's not always a good idea. What I see is that a majority of the people with chronic back pain know that one wrong move and the pain is going to hit you. So since there is that fear, if you will, most of the people end up moving slowly. However, that can often turn into a situation where you could be moving slow, so slow that you end up stuck in a vulnerable, painful position longer than you should. Whenever I'm examining a new patient or doing some joint stability work on them for the first time, I advise people how to sit up properly. Once you understand this and you can demonstrate it, basically you're likely to feel so much more confident that you're not going to end up hurting yourself when you get out of bed or from a lying position to a sitting position. I've never had anyone really have a problem doing this unless, of course, you're having a problem with your shoulder or arm. Then this could be a little bit more difficult. However you wake up, slowly, carefully, you want to get your body to where you are laying on your side, and whatever side you prefer, but you know what you're comfortable with, right? So the key at this point in time is making sure that your head, shoulder, hip, knee, and ankles are touching and remain in contact with the bed. So the idea is that you are going to dig the elbow into the bed so that you can push off, keeping your back straight without any rotation or lateral bending. At the same time you are pushing off with your elbow, you can let both feet slide off the edge of the bed. You should be in a seated position with the least amount of bending or twisting being put into your lower back. And once you're in this position, give yourself a chance to adapt. Make sure that you're not lightheaded, and if necessary, you can always have a chair, a walker, crutches right next to your bed to make it easier for you to go, from seated to standing. This is obviously not going to cure your low back pain. It's just a means for you to potentially avoid aggravating your low back. Doing this is not going to allow you to do something crazy. It's not going to address any cause of any systemic inflammation, joint instability, or address any tissue damage that requires specific products used to repair, which are the different services that we basically offer at Michigan Integrative Health. But it is something that when you make this a habit, you're going to become less likely to flare up your back and hopefully help you get through the day a little bit easier. For more tips on how to better cope with chronic pain, as well as specific information on the different types of services and options you have other than drugs, therapy, chiropractic, and surgery for your back and even your knee, hip, and shoulder, Be sure to give us a call at 586-726-9860 or check out our website at www.michiganih.com.